Well, that time of year, the Medicare Open Enrollment, it ends December 7. So I ask you this question. Have you reviewed your Medicare plan? Whoops. Well, my guest, Cate Kortzeborn, is the Deputy Regional Administrator at the Centers for Medicare and Medicaid Services, CMS, San Francisco office. Hi there and welcome, Cate.
Thank you so much. It's a pleasure to be with you.
Well, if you have a Medicare health or prescription drug plan, my listeners have only until the end of open enrollment, correct? December 7th to make changes to their 2020 plan.
That is correct. December 7th is the date.
Right. So Medicare's new plan finder apparently makes it easy to review and compare Medicare Advantage and prescription drug plans. Now, this finder provides a personalized experience, I'm to understand, that helps you learn about different options and select the coverage plan that best meets your needs. So how does this plan thing work?
Well, we've had the Plan Finder for a long time, and this is the first revamp, big major revamp that we've had of it in about 15 years since we started. And the exciting thing about it is exactly what you said. People can have a personalized experience where if they go to the Plan Finder and enter in their own information, they're going to see what their current benefits are, what their current prescription lists are, what kind of coverage they have for 2019, and then they can also compare side by side the options available to them in 2020 so they can make sure that they've got the correct coverage for themselves.
So, even if you're happy with your current Medicare coverage, comparing plans really pays off, doesn't it, Cate?
It most certainly does, because the plans change things every year. They'll change benefits, they'll change their drug formularies, tweak their prices, add new benefits. And so it's always important, even if you were satisfied with what you had for the current year, to just make sure that that's still going to be the thing that you need for the upcoming year. And in addition to the plans changing things, people's personal circumstances change every year. So what was working for you last year, if you had some kind of a health issue or something happened to you, or you need to take more medication or need a new doctor, it's always good to look at kind of the totality of what's going on with you, both personally and what's going on with your plan, and make sure that you've got the right coverage.
And if you miss the December 7th deadline, you've got to wait a full year just about, right?
Yes, that's true. Our deadlines are pretty much hard and fast. There are very, very limited circumstances in which we can make an exception, but for the most part, if you miss the deadline, you've missed the deadline, and whatever coverage you had for the previous year will follow you into 2020. And so that's why we're talking to so many people right now, to make sure that you realize that there's a deadline and that it's a pretty hard one.
So what do Medicare beneficiaries need to do during open enrollment?
Well, as I said, everyone needs to look at their current coverage, see what they've got, see what their circumstances are, and then find a way to look and see what's available in 2020. And we have lots of resources to help people. Our Plan Finder, which is the new tool that we think is pretty slick, it's on our website, Medicare.gov. And so if you go to Medicare.gov, it's going to be a great big button. You can't miss it. And if you're a little bit daunted by doing something like that on your own, we also have a national helpline that if you call them up, they can help you do the same thing over the phone. That's 1-800-MEDICARE. And that's a good resource for any issues or questions that you have about your Medicare coverage. And then in addition to those national resources, there is an organization in every state called the SHIP, the State Health Insurance and Assistance Program. And it is a nonprofit funded by us and other organizations, and it is staffed by volunteers who are mostly retired Medicare beneficiaries themselves, and they know pretty much everything about what's going on in the local communities. And so you can find those pretty easily you can call 1-800-MEDICARE and ask for the reference to your state SHIP, or you could look online and search for SHIP and Medicare in your community. County departments on aging have the numbers. Most libraries can help you find things. There's lots of ways to get to the SHIP, and those are people who can help you either on the phone or set up appointments, face-to-face appointments, and they really know the local plans and everything in the local communities, and so they're an awesome resource.
When you get around, you sound like you're calling me from the Northern Mariana Islands or somewhere. We've got a little bit of a gremlin in the line there. San Francisco area. Go on.
I'm sorry. I didn't actually hear that.
That's all right. Don't worry about it. Now, some people think, well, hang on a minute. Is it open for me too? I mean, who can participate? Everybody in the Medicare Open Enrollment?
Yes. Every single Medicare beneficiary can participate, and we really want every single Medicare beneficiary to participate because we think it's that important. You know, as I keep saying this over and over to everybody, you never know what the circumstances are going to be. You never know what's going to happen to your plan. I was at an event last weekend assisting some awesome pharmacy students who were helping people enroll, and we had a couple of people who by changing their plans from one prescription drug plan to another, we're going to save a couple of $1,000s over the course of the year. And for someone on a limited income, that is a very exciting prospect. So it really makes a difference. You really need to check.
Now, you mentioned it before, but I always like to repeat things because people never get it the first time. The resources online that are available to people, I guess primarily it's the website, right? The one that you mentioned?
Yes. And that's our website, Medicare.gov. And the Plan Finder tool, it's a great big button. You can't miss it. And that site has lots of other information for people if they're looking for information about benefits and things like that. And then our national resource hotline is 1-800-MEDICARE. We try to make it easy. So 1-800-MEDICARE, and they can help you on the phone, or they can hook you up with local resources in your community.
Right, 1-800-MEDICARE. Now, it started, of course, on Tuesday, October 15th, and it ends at midnight on Saturday, December 7th. At that time of the year, people can get help in their local community. Now, you're the deputy regional administrator at the centers, and your area from the San Francisco office is quite large, isn't it? I mean, you cover most of the Pacific Flag territories, Guam, the American Samoa, of course, and the Commonwealth at the Northern Mariana Islands. How do those people get on with this type of thing? I mean, are they under the same sort of restrictions? Have they only got that enrollment time as well?
Well, everyone has the same enrollment time for these programs, and anybody who is a Medicare beneficiary has access to various types of plans. Obviously, since in the outer Pacific we're talking about small places that are thousands and thousands of miles away, so some of their options are going to be more limited. But everybody has options, and so everybody does the same thing at the same time.
Okay, so you must do a fair bit of traveling, I guess, in your territory, Kate. Do you?
Well, actually, I stay at home. I make other people travel.
Ah, you're the lucky one.
Yes, yes, we do have staff that make trips out to the Pacific and out to Hawaii, which is one of the states that we cover. And there's Medicare beneficiaries everywhere, and we need to take care of all of them.
Well, the San Francisco regional office, it does span a vast geographic area, and it has one of the most culturally diverse populations in the nations. I think, 14 million Medicare, Medicaid, and Children's Health Insurance Program beneficiaries all up. That's a lot of people to look after, isn't it?
Yes, it is, and we take that responsibility very seriously. We're very proud to do our work, and we love our region, and we love the cultural diversity, and we really do love the challenges that it presents us. And I've got an awesome staff here in San Francisco, and we do really good work.
You do a great job. Well, Cate, before we go, I just want to reiterate the two important things again. One of them is a phone number, free, which people can get help with, and the other one is the website. So if you'd like to repeat those.
Sure. Our toll-free number for national help is 800-MEDICARE, 1-800-MEDICARE, and our website is medicare.gov. And remember, your last day to sign up this year, December 7th. So keep that in mind.
All righty. Thank you. Kiss me, Cate Kortzeborn, Deputy Regional Administrator. Thank you. Have a wonderful day. And what a Deputy Regional Administrator at the Centers for Medicare and Medicaid Services in the San Francisco office. And boy, are they busy. Hey? So don't forget, all right? It's too important for that sort of thing. You heard it here on The Mark Bishop Show. And look forward to another episode coming up shortly.